A heartbreaking issue that affects the most innocent members of our community. Lawmakers tell us that every 25 minutes, a baby is born with drug exposure. Every 25 minutes. Well, this week, West Virginia's U.S. senators announced the release of a national study that is the first of its kind. And as News Channel 3's Caitlin LeBeau reports, the study takes a look at the neonatal abstinence syndrome, which is when babies are born addicted, and found more federal action is needed to help these newborns.
They enter the world already addicted.
That's about the worst part of this drug epidemic and the drug crisis that is going on.
Dr. Rahul Gupta, the state health officer in West Virginia, says help is needed for babies exposed to opioids.
There's a lot of options available, but not enough options.
A national study released this week calls for federal action.
I think we got to recognize how large the problem is.
West Virginia Senator Shelley Moore Capito says that especially rings true in the Mountain State, where nearly 1 in 20 babies are born with a drug dependency.
In West Virginia, we have a huge problem, we know, with drug and opioid abuse.
She and Congressman Evan Jenkins are bringing attention to a study that addresses neonatal abstinence syndrome, or NAS. It talks about educating expecting mothers and getting them help if they have already used drugs while pregnant.
There hasn't really been a comprehensive plan forward by HHS, and that's what we're looking at.
HHS, the U.S. Department of Health and Human Services. Capito says she and Jenkins are pushing for more help at the federal level.
That's education, that's prevention, that's diversion of drugs.
And having that help available for mom and baby at more stages, from prenatal care to following up over the years.
So that we make sure that these kids, as they grow up, are not misdiagnosed, they are not excluded from society. They perform as well as anybody else.
To make sure their lives aren't defined by the way they started. Caitlin LeBeau, WSAZ News Channel 3, Charleston.
And Capito says that she and Congressman Jenkins have also worked on making sure education and resources are not only available in the hospital setting, but in non-hospital settings as well, like Lily's Place, a center in Huntington that has provided specialized medical care to infants born addicted to drugs.